Hi, Nancy, and participants of this Conscious EFT workshop. I'm so happy to be here and share my personal and clinical experiences of using EFT. It came into my life as I was working in a large community hospital and just noticing the stresses that the staff were facing with the workloads, the violence, the increase in conflict and just taking incidences home that they weren't able to deal with, ruminating about them, and the challenges that were affecting the relationships too that were breaking down. And so I started to look for tools that I could help, and EFT was one of those first ones that I came across. And I noticed really subtle changes in myself after I was using them that I just noticed I had a calmness that came into my body. And I still find, after many years of using this, that it continues to be that way. I noticed that I would show up to work feeling more confident to be able to take on challenges that I normally wouldn't have, I would not be raising my hand and say, yes, please pick me. That was not my go-to. It was not an evidence-based tool when I was started first using to practice it. And so I went back to school to be a psychotherapist in order to practice other tools that were evidence-based. But this is my number one go-to for anxiety. It really has supported the work that I do to support staff in the workplace. And when I got positive feedback from leadership, I was also doing it in groups after debriefings, and it was really essential and it helps support people from not going home some days, which is great to get that kind of support and help. And in my experience was with the medical staff, I find that we know the anatomy and physiology of our nervous systems and caring for others, and it's such a satisfying role that we play, and that it shouldn't come at the expense of our own health. But I found that we're not great about looking after our own nervous systems or listening to the signals of our body and what we need. And so being able to teach and educate brain states to staff has been really effective in understanding how these stresses is much in our biology as well as our psychology. So I use it in clinical practice when I'm tapping with my clients because it helps me to process and borrow the benefits from that. And I also use it at the end of a session. If I don't know what parts of the day that I may have taken in that have been negative or triggered me. And so by doing my own tapping, I really find it releases that negativity that I don't know I've been holding on to. And it releases it so that by the time I get home, I drive home, that I have a different perspective on it. Or in between clients, it's really effective to downregulate and self-regulate my own emotional states. And having your fingertips on your person as you go through the day is really helpful. What else do I want to share with you? As I know I've only got a couple of minutes here. I just find reducing the burden of carrying that negativity around can just change a lot of your limiting beliefs. I didn't know the limiting beliefs I was holding on to until I started tapping. And I actually went on to write a book called Shift Stress for Healthcare Workers, because that was what really helped me to let go of a lot of things I was carrying that I didn't even know I was. It increased my potential to be, the person I am today. And I'm so grateful for tapping to bring that into my life. So have fun with it with Nancy, enjoy the class. And if you need help, please reach out for support. Bye-bye for now.